As the world slowly begins opening up again, a new Mercy ship is able to get back to work providing life-changing surgery in West Africa. The Mercy Global has space for 200 patients, 6 operating rooms, a lab and outpatient clinics. Staffed solely by volunteers, the Global will see more than 1,200 medical professionals from 60 countries, and that includes 40 Kiwis giving their time and expertise on the ship in the next year. Well, Dr. Andrew Clark joins me now from the Mercy ship in the Canary Islands. Andrew, we are seeing health systems around the world struggling under COVID. What's the impact been in Africa are working?
Yeah, I mean, it's obviously impacted the way we do our work because we live on a ship and ships have a much more sort of infections go around on ships a lot more than on land. So we've not been able to get to Africa until this year. Yes, it has affected Africa, but surprisingly, Africa's come out pretty reasonably with that. And it's an interesting thing when you think about it, because I think a lot of people think that communicable disease is Africa's greatest problem. You think about things like HIV/AIDS and tuberculosis and malaria. And yes, that does account for some 2 million deaths, which are tragic. But the biggest problem in Africa by far is the lack of access to safe, affordable, and timely surgery. That accounts for some 17 million deaths every year. And so that's a huge tragedy. And so Mercy Ships works exclusively with surgery because we see that as one of the greatest healthcare needs right now in Africa.
And what are you finding now that you're able to get back to Senegal?
Yeah, we're back in Senegal right now. That is quite a needy nation, like a lot of places in West Africa, which is where our focus is. We have obviously seen people. When we were in Senegal before the COVID hit, we had to then leave, and all of those people had to wait for their surgeries. And so their tumors got bigger and they were quite problematic. So we see a lot of maxillofacial surgery, maxillofacial problems, tumors there, cleft lip and palate tumors, orthopedic problems. But, you know, the general need in Africa is huge. About 9 out of 10 people in sub-Saharan Africa lack access to safe, affordable, and timely surgery. And so it is a massive need. And wherever we go, we always have a lot of patients that need this kind of care.
And you have a new ship just built to extend that work that you're doing.
Yeah, the Global Mercy is a purpose-built ship. She was built for us in China. She's 174 meters long, about 37,000 tons. So if you think of the largest inter-island ferry, that's 22,000 tons. So it's a pretty big ship. Has 12 decks, and it has a 7,000 square meter hospital on board with 6 operating theaters with about 199 patient capacity. And one of the coolest things too is the people of New Zealand came together and donated enough money to purchase or to pay for the 7 intensive care beds on board the ship. And so if you go outside intensive care, you'll see with love from the people of Aotearoa, New Zealand.
It is life-changing work. You must be really proud of what you're doing over there.
Yeah, I am really proud of it. But, you know, it's not just, it's a team. It's an incredible team of amazing people from about 50 different nations around the world who come together, you know, with the same purpose in mind, and that is to bring hope and healing to the forgotten poor of the world.
Well, you have our support. Thanks for joining us here on 8 o'clock.
Yeah, thanks very much. And thanks to all the Kiwis who give and who come to serve. We love the Kiwis that come and serve with us.